founder, Chris Rain, to the stage to tell us more.
I wanted to invite you to each close your eyes. Take a moment to think in your life, in your friends' lives, in your colleagues, in your families, is there someone that is dealing with a daily addiction? No matter how many times you've had conversations with them, times you've picked them up off the road, times you've helped them, it's something that they just can't shake. Now, anyone in this room who can't think of a person, I'd like you to raise your hand. Now, please open your eyes. There's 4 people. In this country right now, 1 in 20 people have some form of harmful daily addiction. My purpose in life is to move that number to 1 in 100 over the next 50 years. I'm here tonight to share the story of Clean Slate, which is a program focused on one specific part of that problem, the problem of detox. Now, the thing about alcohol detox is it's the one drug that if you tell someone to go cold turkey, it can actually be harmful, in some cases actually lethal. So what people need to do it safely is a clinically supported medicated detox. Now that means going to hospital or rehab, which is fine if you live in cities, if you have health insurance or a spare 20 grand, if you can take a month off work. But for the other 250,000 Australians who don't fit those brackets, this service just does not exist. 2 years ago, I met this amazing doctor, Dr. Chris Davis, who built this model through his GP clinic to enable people to go through a detox without having to go to rehab or hospital. He did it affordably and safely and effectively. And together with our other co-founder, Pia, we decided to build a company that could take this program into a telehealth platform to share it across the country. Over the last 12 months, we've built this great team of people who are sick, people experts in this field. They're sick and tired of having to deal with this problem and not having a solution. And they've joined us to now have put through 100 people through our first pilot with University of Sydney evaluating it in Metro Sydney. We were able to demonstrate a relapse rate of 15% at 3 months. And when you compare that to traditional treatment, when you get 60%, you're doing really well. We're able to provide our service, which includes seeing doctors and nurses and bringing it into a person's home for under $3,000. And when you compare that to a state-funded detox, it's 15 grand. And when you have private detoxes, it goes up into the tens and hundreds. We've built this model, we've tested it, we've evaluated it, and now we want to take it into the furthest reaches of the country. Our social enterprise is called a bush detox. We know in this country that people in regional and remote areas have the hardest time of accessing care, particularly in regional Queensland, regional New South Wales, and across WA. Support health staff just can't get out there. They can't get them there. You have to travel enormous quantities or enormous distances to actually get that care. We want to take that service into a person's home so that when someone needs to detox, they get that care where they are, on their farm and in their community. Over the next 3 years, our ambition is to detox 1,000 people across regional and remote Australia, to build the infrastructure to do it, to support people, to build a team that can do it. And I want to invite you to come on that journey with me. We think that by doing this, we can actually solve a direct problem in our regional and remote areas, something that when you think about that person that you care for, when they need that help, that there's a place that you can send them. Now tonight, I want to invite you to contribute to this journey. $100 will provide the package that goes out to our participants with a breathalyzer, vitamins, and the care that they need to have a successful detox. $500 will provide the nurse calls that happen, that take them from the very moment that they write to us through the 2-week prep period that they need to go through to remove alcohol in their home and get a support person. And $3,000 will provide a complete detox, perhaps to a stranger, or perhaps to someone that you love and care about. So today, we're only young. We've just started. But I think we have an enormous potential to fundamentally change this problem in this country, to move towards a country where people aren't wrapped with this daily addiction, where when they want help, they can get it. That's the country that I believe in, and that's the journey that I want you to join me on. Thank you.
So guys, here we go. $70,703 for Clean Slate.
And the sunlight hurts my eyes.